Hi, I'm Francis. Welcome to all the Pelham volunteer firefighters here with us tonight. Meet my co-presenter.
Hi, I'm Frank. I'm a retired firefighter. We will be discussing some common mental health problems for firefighters, including depression, anxiety and panic attacks, substance use dependence, and PTSD.
Our mental state affects the way we think about ourselves, relate to others, and how we interact with the world around us. Our mental health affects our thoughts, feelings, and behaviors. So we need to care for our mental well-being.
Mental health problems and operational injuries can disrupt a person's life at work and at home. However, with the right supports, we can get back on the path to recovery and wellness.
Depression has emotional, physical, and cognitive effects. Emotionally, you may experience sadness, mood swings, hopelessness, and anxiety. Contrary to popular belief, you cannot just snap out of it. Behaviors of depression can include crying spells, withdrawal from friends and family, neglecting personal appearance, decreased motivation, can't get out of bed, and lack of interest in previous activities.
Other symptoms include self-criticism, difficulty making a decision, the belief that everyone would be better off without me, poor concentration, thoughts of suicide. If this is you, please talk to a friend, see your doctor, or call the Coast Crisis Line.
Frank, depression and anxiety often, but not always, occur at the same time.
Yes, I understand that studies have found that half of people with either anxiety or depression have the other condition. If you have experienced inappropriate worry, apprehension, or uneasiness, you can't focus, insomnia, or fear of losing control, you may be experiencing anxiety.
I'm so anxious, I don't know what to do.
Excessive levels of anxiety interfere with day-to-day living, such as work and relationships.
Symptoms of severe anxiety or panic attack may include chest pain, heart racing, rapid breathing, shortness of breath, difficulty getting air, dizziness, sweating, tingling, dry mouth, stomach upset, shaking and nausea, vomiting or diarrhea. If you thought many of the signs and symptoms identified resemble a heart attack, you would be right. It's not always easy to tell. If you believe you may be experiencing a heart attack, call 911.
Managing your thoughts and behaviors can go a long way toward reducing the frequency and intensity of symptoms. A panic attack is your body preparing you to deal with danger. If there is no danger, your body is giving you a false alarm. There are 4 steps you can take to deal with this situation. 1. Accept that this false alarm is happening, and get to a quiet area if you can. 2. Take deep breaths, or meditate, using an app on your phone. 3. Remind yourself it will not last. It will end. 4. Allow yourself to ride it out, by continuing the breathing exercises until you are calm again. You can also call the crisis line to help get you through it.
So, if you find yourself ever experiencing depression or long-term anxiety, a visit to your doctor or seeing a counselor is a good place to start. A 3-pronged approach offers best results. Recovery for some includes medication, for others, counseling and social supports are sufficient.
I'd like to talk a little about substance use dependence. For those who don't know, it is considered a mental health problem. With dependence, there is continual use of a substance, drugs or alcohol, even though it is causing significant harm. Often, repeated use builds up a tolerance, and we experience withdrawal if we don't take the drug. Eventually, a person moves toward compulsive drug-taking behavior. So, for firefighters, the longer the length of service, the higher is alcohol consumption and the possibility of developing symptoms of depression. This is thought to be the result of emotional distress associated with the occupation. Beneficial use is use that has a positive health and social impact, such as proper use of medication or moderate consumption of red wine. Casual use is using responsibly with low risk of harm to our health, work and family life. Problematic use is use that begins to have negative consequences for the user, their friends and family, or society. Examples include impaired driving, binge consumption, inability to function at work, or problems in a marriage. Lastly, chronic dependence is use that has become frequent, compulsive, and leads to negative impact on your health and in your life. I know how hard it is when you see a lot of traumatic scenes. I was someone who abused alcohol in my 20s and 30s. Sometimes life gets difficult for all of us. If you find yourself in the categories of problematic use or chronic dependence, consider seeking out one or more of the following treatment options. Self-help groups such as Narcotics Anonymous or AA. You can access counseling for substance dependence through CASN or the ROM Clinic at the St. Catherine's General Hospital. Or, you can call one of the many withdrawal management clinics in Niagara.
Let's talk about PTSD, post-traumatic stress disorder. Now often referred to as an operational stress injury when related to a person's employment. It's important to know that stress and anxiety are normal reactions to an abnormal event immediately after experiencing something traumatic. However, when the distress starts lasting longer, past a few months or more, it can become problematic. What do we mean by exposure? A person can be exposed to a single direct experience, or witness trauma happening to others, or through a repeated event. Also, what one person finds traumatic may hold no fear or anxiety for another. We are all different, socially and biologically. Exposure to adversity and traumatic events on a regular basis place firefighters at risk for PTSD.
Trauma can result from childhood emotional and social neglect, loss of loved ones, physical and sexual violence or emotional abuse as an adult, and from direct exposure, or as a witness to dangerous life-threatening situations. Symptoms of trauma can include fear, anxiety or hypervigilance, anger or aggression, emotionally or socially withdrawn, loss of enjoyment and pleasure, experiencing flashbacks, feeling as though you are reliving the event. You may also avoid experiences related to the traumatic event, such as people, places, and conversations. You may feel uneasy or irritable and have intrusive memories of the event, as if it's happening over and over again. I think you will understand, then, why a high risk of problem substance use exists for those with PTSD. Those who experience this condition self-medicate to numb the pain from the symptoms. They also have 6 times greater risk of attempting suicide. The relationship between PTSD, problem substance use, and suicide is significant, with very real adverse consequences. Early intervention is important. Some PTSD treatments include medications for specific symptoms and talk therapies, which help to find ways to understand the difficulties you are experiencing. A more recent, promising addition is the use of mental health support dogs. It has been found that support dogs can positively influence the welfare and quality of life of those with PTSD.
So in summary, we provided a brief overview of the most common mental health problems for firefighters. Please remember, it's important to seek early intervention if you are experiencing symptoms of any mental health condition.
We also want you to know that experiencing and talking about mental health problems is not a weakness. It will actually strengthen you. We wish all of you the best. Thank you.